Hello everyone, this is Jin, a TCM practitioner and instructor in Victoria, BC, Canada. Here is my online class for acupuncture case study. The book we use I put below. I hope I can help the students study and review for the class. Okay, let's start.
Okay, let's discuss together. Ill his name. Yeah, insomnia. Yeah, that is the Chikabla here. Chikabla. Part. Heart and the kidney indicacy. Deficiency heat. Yeah, heart indicacy, heart kidney indicacy. Yeah, heart and the kidney indicacy. Yeah, heart and the kidney deficiency kind of condition. We also can say heart and kidney disharmony. Yeah. We can say heart and kidney indicacy. Or heart and kidney is yeah, not all part. Yeah, not all part. Yeah, when we're talking about the degrees, it means some degrees heat inside. Yeah, you can put the degrees heat in there also. Yeah, but mainly it's in degrees. Yeah, I did not discuss for the symptoms here. Like anything relationship with sleep, we're talking about like weak appetite. What do you think about why the weak appetite coming? Some of the immune deficiency result from underlying immune deficiency, T deficiency. So when we're talking about T deficiency, certainly is appetite in there, but look like we're looking at other symptoms like short breath and people tired, even losing stool, but the bowel movement is normal. And they didn't talk about other symptoms relationship with T deficiency. So we are not diagnosed for T deficiency. And some of the deficiency, usually we talk about the people feel hungry but don't like to eat. And sometimes let me burning sensation in the stomach. But look like now the true relationship with empathy, disturbing appetite. Yeah, it's kind of a relationship in there. It's kind of a relationship in there. If they don't have other symptoms, the regular relationship with appetite. We're thinking about that also people long term, like insomnia, like for a few years, couldn't sleep well, and truly damage their body all over functions, including digestive function. Yeah, it's a kind of amplitude. Yeah. But we are not especially diagnosis on it. Yeah, so that's appetite. And the other symptoms look like weakened activation by both heart and kidney disease in the other symptoms. Okay, treatment principle. Yeah, our treatment principle. Yeah, nourishing heart and kidney, clear deficiency, and coming the spirit. Yes, that's good. Yes. So in the book, they talk about harmonize heart and kidney and nursing in clear heat and calming spirit. Yeah, that's the basically the same thing. Yeah, basically the same thing. Okay, so the points. Yeah, the points. What points do you like to use? Kidney 3, heart 3, kidney 6, bladder 23, bladder 50, and yes, that's good. Yep. Kidney 6, heart 7, heart 7, heart 8, heart 6, heart 48, kidney 6, kidney 2, yes, good. Lung 7 and kidney 6, yes. Then 14, heart 7, heart 46, 7 to 36, yes, that's good. Yep. Yeah, your voice is good. So book points I write in here, 222, 220, yeah, 220. That's basically coming the straight, yeah, coming the straight. And hard 7 and half, that's working for the heart, working for the will come in straight and working for some time in. And they use 3-6, especially for in 3-6, working for in. And another point is pretty interesting. They use stomach 36 and to the directions bladder 37. That's pretty interesting use. So we know bladder or stomach 38. Usually we use treat shoulder problems. But the combination use this one. They try to like clear some heat. We talking about the heat in deficiency, some deficiency heat in there. They try to clear some heat from bladder channel and relieve from the stomach channel because stomach channel is more tea, more blood, and it's like more young. It's a little bit easier to relieve some heat. So that they use this kind of combination. It's pretty interesting. So, but your points here, yeah, all looks good. Yeah, all looks good. Yeah, yeah. Everybody have their own treatment plan. Yeah, they are not necessary to follow others. Yeah, you can make your treatment plan, and each time you pick up some points. Not like use all the points, but each time you pick up some of the points. Yeah. So that's for this case. Yeah, that's for this case. So I think we cover review class. We just talked about if patients insomnia, same time have kidney deficiency, we can name it hard and acute kidney disease. So that's usually we oh, okay, okay. Anyway, I mean, oh, okay, we do it. Yeah. Okay. Yeah. So that's we say. If a patient have heart and kidney deficiency kind of condition, heart, especially people have insomnia disorder, we can specially name it heart and kidney disharmony. So that's for this case. That's for this case. Any more discuss for this case?
Jen,
Yes, go ahead.
with the poor memory and dizziness, is that also marrow deficiency?
Yeah, it is also. It could be coming from blood deficiency and it could be coming from marrow deficiency. Yes.
Okay.
Yeah. Yeah. And the sore weak in the lower back usually is kidney deficiency. And the knee joints, yeah. Knee joints could be kidney, could be the liver. Yeah. But if with lower back together, usually we say that go to the kidney. And restless is kind of heat condition. Yeah, people feel restless and feel hard in the chest means some upper jaw heat. Mouth is dry, is heat damage body fluid. Difficult feel sleep. Yeah, difficult feel sleep is the heat symptoms, and the dreams is heat symptoms. Can coming from excessive heat, can coming from deficiency heat. So that's heat symptoms. Yeah, I think that's good for all the symptoms. Yeah. Okay. Yeah. That's good.
Right. Do you ever use the outer spirit points at all in your practice for the
Yeah,
bladder channel, like Shen Tong, bladder 44, the outer point of the heart, or Hun Men, I believe it is, the outer shoe point for the liver. Just I'm reviewing a lot of like foundations for boards, and I'm sure we all are. And when it comes to any issues with like anchoring yin or anchoring blood and the restlessness and lots of dreams and difficulty falling asleep, the theory is all in anchoring the spirit of the organs. And we don't talk much about the outer bladder channel points. I was wondering if, yeah, you use them at all or have experimented with them.
yeah, the outer bladder, yeah, we have two bladder line in there. So basically, for my practice, I use the first bladder line like organ difference. Like we talk about the heart, spleen, and maybe the lung. So kind of difference, I like to use the first line. The second line usually I use for like spirit problems or shed problems. So that's kind of condition I like to use the second line. But not that too clear separate. Like deficiency kind of condition, you still can use the second line. Like if people coming for like a regular treatment, you can at the later line, like the first line and the second line. But just for my practice, uh, I especially like second line. Look like working for Shendong disorder is better, and the first line look like for organ deficiency is better. But truly you can use both. Yeah, yeah, and especially for bladder 43, is a special kind of poise. It's pretty stronger tonified functions. It's pretty special kind of deficiency. Go to that poise.